The Australian Medical Association has delivered another grim assessment of public hospitals. In its annual report card, the AMA found hospitals are still struggling to meet demand, despite extra Commonwealth funding. The number of beds per capita continues to decline, while waiting times for elective surgery are getting longer.
It's another bitter pill. Australia's public hospitals are overcrowded, under-resourced and poorly managed.
And sadly, our report card again has shown that there's been a deterioration in the amount of care being able to be delivered to our patients.
The AMA looked at three key indicators of performance: bed numbers, waiting times for emergency departments and elective surgery. In 2009 and 10, there was an extra 378 public hospital beds, but there are fewer beds per capita, and that means longer waiting times in emergency departments and for elective surgery.
So far, we're actually slipping back. We're not going forward. We'd like to see new beds.
Around the country, New South Wales suffered the biggest fall in bed numbers, down 197. South Australia was the only other state to lose beds. The biggest winner was Victoria, followed by Queensland. The pressure on emergency departments continues to grow.
It's a lot of strain on a lot of people to get the work done and specifically to take care of patients in the way that we want to.
Elective surgery waiting lists are getting longer. 35 days is the median waiting time. The ACT is the worst performer, with patients waiting 73 days, more than twice the national average. Patients in New South Wales and the Northern Territory are waiting 44 days, while it's a 36-day wait in South Australia, Victoria and Tasmania. But the government argues the report is out of date.
I think the AMA have got in the habit of criticising, and they have forgotten to acknowledge good news.
The government says there's plenty of it: extra beds, doctors and nurses, and an increase in organ donor rates. Rebecca Barrett, ABC News.